right, folks, welcome back. Y'all, our guests today are talking about something that I find incredibly important, having served as the director for clinical education at 2 universities, as well as supervised over 25 speech babies individually and practicums. And our topic today is professional identity in speech language pathology students. And if you haven't ever really grasped this concept before, there's so much biasy that can be wrapped around the word professional. And when I read this article that came out in SIG 10, Issues in Higher Education, it was actually a year ago. The publication came out in December. All of our authors are on today: Dr. Belinda Daughrity, Dr. Anita Fitzgerald, and Dr. Sharon. I misspoke. Dr. Sun is actually not here, but we have 3 of the 4 to talk about something that is so key. So I'm going to ask everybody that's listening to open their hearts to a topic that we need to hear and view from different viewpoints, especially at a time when having a different viewpoint can be so ostracizing in the world. Because I'm really hoping that if you haven't done this yet, that in 2026, you're going to reach out to your alma mater. You're going to reach out to a nearby college or university and offer your time to be a clinical supervisor so that you can be the source of change. So please join this conversation and let it light a fire in you. And I know that came out twangy, but let it light a fire in you so that next year you're ready to be an ally. So, ladies, hi. Thank you so very much. With all things, this took a couple iterations to get here, but we're here.
We made it. So here we are.
So, Dr. Belinda, I actually met you for the first time in person at ASHA.
Yeah. At ASHA 100, we had a lovely run-in. It was great to meet you in person before we did this. This was great.
Yes. And it was, honestly, most of my meet cues are running to the bathroom because pelvic floor therapy post-children is key. But I didn't run into you outside of the bathroom.
And we did not. We met in between receptions, which is great. Everyone kept their dignity. It's lovely.
Please know my son is over there going, "Good job, Mom." Because every time I sneeze, I'm like, "Oh, didn't pee."
Yeah, that is real.
But Dr. Belinda, please introduce yourself for those that haven't met you yet, and we'll just kind of go down the line if that works for everyone.
Sure. So, hi, everyone. I am Dr. Belinda Daughrity. I am a bilingual speech-language pathologist. I use she, her, hers pronouns. I am a bilingual speech-language pathologist from Los Angeles, California. I am a rare breed where I am native to Los Angeles. So I'm from here, went to school here, left to go to Spelman College in Atlanta to do my undergraduate degree in English and Spanish. Went from there to NYU to do my master's in speech language pathology and audiology, and then returned home as the only child typically does, returned home to UCLA to do my doctorate work following my clinical fellowship experience. So I am currently an associate professor at California State University, Long Beach. I'm in the speech language pathology department. I serve as one of the advisors for our CSULP National Student Speech Language Hearing Association chapter. I'm also currently serving as National NISLA advisor. My term ends December 31st. It's been a 3-year term, and I've been really intrigued by this topic of professional identity development. And I was so just blessed to meet Sharon and Anita, who brought this topic to us and sent out this call of who would be interested. And I will kind of popcorn over to them so they can kind of give their own background and talk about how we got into this as a topic area.
Beautiful. Sharon, you're next to Belinda. So how about you go?
Well, thank you very much. And thank you for having me. It's nice to be a part of this conversation to grow and have more awareness of our professional identity. I'm a registered nurse. I'm not a speech language pathologist. Been a registered nurse since 1995. I have my associates, my bachelor's, my master's, and my doctoral degree in nursing. I've spent about 30 of those years practicing at the bedside, primarily in adults, acutely ill patients, and I've been at Cal State Long Beach since 2009, working as a faculty member. I'm currently involved with our California Nursing Student Association. I'm one of the faculty advisors for that. And I'm very proud to be part of this faculty, a part of this great organization. And I'm really, really glad to have met Dr. Anita Fitzgerald, because this is her primary work. And I would just happen to be at the right place at the right time. And I was able to join her work with her professional identity. So thank you, Dr. Fitzgerald. You are an inspiration to many, many people.
Yes. Well, honey, that's one heck of an intro. I can't top that. So, Dr. Anita.
Hi, I'm Dr. Anita Fitzgerald. I am an associate professor at the School of Nursing at California State University, Long Beach. I am also a native of Los Angeles, so I did my own forays out and always came back, just like you, Belinda. I've been teaching in the School of Nursing for 20 years. Just got my 20-year award in a variety of roles in the clinical setting, in the classroom. I got my associate degree and my associate degree in nursing in LA at Mount St. Mary's, then Mount St. Mary's College. My bachelor's and my master's are both in nursing, and they're both from Cal State Long Beach, where I teach. And my PhD is in nursing education, and I got that from the University of Northern Colorado School of Nursing. So it really began as part of my doctoral dissertation looking at professional identity, and at the time looking at it in nurses. But I've always had a real appreciation for the work that's being done in all different kinds of settings. And I was really eager to do an interdisciplinary study to sort of look at this and looking at, how we as faculty can support professional identity development in our students. So that's kind of the focus of what we did. And I'm just so honored to work with Belinda and Sharon, I think, and Lei, because I think our collaboration was really mutual and productive.
Speaking from the heart, I appreciate that y'all acknowledge where y'all went for school, but also that you acknowledge having an associate's degree. And I say that as someone who has an associate's degree, because I'm the oldest of 5. There was no money for school. I worked multiple jobs at the same time going to college, got an associate's, bachelor's, master's, did not pursue a PhD, veered off and got my board specialty certification in swallowing disorders. Because for the tiny humans, Dr. Sharon, adult boogers are way too big. I'm out. But tiny humans. But I think that's what, when I was reading the article, I kept coming back to was, I don't know, and Dr. Belinda, I don't know if you know her, Dr. Michelle Manorman. She's volunteered with, I know she's done some with CAPSID as well, Council of Academic Program for Communication Sciences and Disorders, for those of you that are not familiar with the acronym, as well as with MBASLA for the Praxis Test Prep. But she was one of my mentors. And she instilled in me the fact that we have to help students that are coming from different walks, because not everybody is entering from a PWI, a predominantly white institute, and or from a nuclear family. I wanted to say atomic because they're so rare, but like a nuclear family. But to hear leaders in the field acknowledge where they started, I think that helps build a solid foundation for the conversation.
Yeah. I was just going to say, we tell our students all the time, like, never stop, right? Always keep going. You'll surprise yourself where you end up, right?
Yes.
And then just along the lines of what you were mentioning, Michelle, the idea of students coming from different backgrounds. I think in particular in our field in speech language pathology, I'm going to take heed to the initial kind of meditation at the start about saying the things that need to be said, right? When we look at ASHA and we look at our membership is filled with really passionate people who love what we do, which is great. It is also really challenging in regards to a representation component, right? We know that our field is more than 90% consistent of monolingual white women, which is great. Also consistent in other disciplines, other allied disciplines. But when that doesn't represent who you are, a lot of times that can be something that is challenging when you enter a space and you think, is this a space where I should be? And so when Sharon and Anita kind of sent the call about this potential topic, I just thought that was so interesting. And my work as a national NISLA advisor and advisor for our student club that's coordinated with that. I'd been our undergraduate mentor at our department for a while. I did a lot of work with students, particularly first generation students. And I keep being drawn back to the question of how do we help students feel that they belong and know that they do belong, and how do they get support in kind of shifting their mindset so they don't feel like they are, like they snuck in the back door in some way, but like they are welcome in this space, that they are encouraged to be in this space. So I think that is super important as a way for us to continue to recruit and retain more diversity within our professions, because that certainly makes the room and makes the table more enlightening for everyone to have, varied perspectives and backgrounds and insight. And so that's something that I'm just super passionate about. And I think that sharing our trajectory, whether that is getting an associate's degree or coming from an HBCU or, having another career and then coming back into this profession, I think is really important. We've had a lot of students over the years come from nursing, and it's always been great to work with those students because they were figuring out where they wanted to be in our field. And nursing is at our institution is really challenging to get into, and it's a very program. We have a really incredible nursing program. So students who we have worked with tend to want to go into the medical side of speech language pathology and didn't know that was possible. And so that's something that has always been interesting as well.
Yeah. I kind of want to pick up on, too, what you're talking about for belonging in a couple of ways. I think it's so important to help people feel like they belong and they're a part, like they not have earned their space, but they deserve, like they are, like to take up that space. That is their right. Right. And there's two things I think about that. And one is, of course, we know that an increased sense of belonging helps a student do better in school because they feel like they can approach professors because they have a right, or that just that feeling of belonging is so important. But it's also a really important part of professional identity, too, because part of having a sense of the professional self is belonging to a group of professionals, to a group of speech language pathologists or nurses or whatever their profession is. And if you don't have that true sense of belonging, then it does diminish your sense of self as a professional. Yeah.
So one thought when I was reading the article, which folks, I promise we'll get to the actual questions, but I have y'all's brilliant brains, but I have ADHD. Bless it. I had to get reassessed about a month ago because perimenopause really amps up ADHD symptoms. Just for those of you that are heading down that pipeline. And even though I got diagnosed as a kid, my parents were going through a divorce. It never got officially put on paper, right? Things happen. So I was telling my mom about it, and she goes, "Well, darling, how much of the ADHD do you have? And I was like, oh, it doesn't work like that, Mom. But like, also bless her heart, she was trying, right? But I can tell you the professional identity piece I have struggled with within the framework of academia, being the neurospicity faculty member and being unaccepted and unwelcome because I wasn't quiet enough. I walked too fast in the halls. You're really busy. And I can't tell you how many times I was told that, or, well, that's not the pace that we go at. And I'm like, well, all right, but I mean, y'all are going slower than molasses in February, and that don't go real fast. And that's something that I've wondered for future research. Have y'all looked at professional identity within like neurodivergence?
Wow.
That is interesting. That hasn't, Anita, do you want to speak to that?
No, go ahead.
I was going to say that we haven't looked at that component. I think for where we are, because this was our first go, this would be our second publication as a group of four together, our kind of Fab Four group here. But one of the things I'm interested in talking with our research collaborative is looking at different facets of mentorship and how that might shape professional development in students as they're going throughout the field. So there are a number of great programs, kind of systems that have worked with mentorship with students in CSD to try to support recruitment and retention, particularly of underrepresented groups in the field. Impact is one of those that just received a National NISLA award. The acronym is escaping me at the moment, but led by Dr. Jessica Sullivan and Dr. Lauren Calandrucchio out of Hampton and Western. Yeah. And so they've done incredible work, and their work was recognized this past ASHA convention. But I'm just super interested in thinking about how targeted mentorship programs can support students and how that can help to grow their professional identity development as a whole. So that's something that my next sites are kind of focused in that direction. And I don't know if Sharon and Anita have particular groups that they're looking at or facets of this research that they're hoping to, research, you to continue to pull that a little thread and see what comes next out of the tapestry. So
I think that piece about mentorship too can really speak to that issue of neurodivergence, right? Because if targeted mentorship, individual mentorship, really has the potential to sort of throw off that cookie cutter, this is how you have to behave kind of identity, and welcome the diversity of all sorts that we need in our professions. Yeah.
Yes. I literally had to have a crucial conversation with a faculty member that reported to me when I walked past her office, and she was chewing at a student for their executive dysfunction. And I walked past and was like processing a thought, and then processed what I heard, and then threw the brakes and went back to the door and said, hi, and interjected myself in the conversation because I knew this was one of those moments that was going to make or break that little speech baby. And I say that because those are the lived experiences that allied and medical need, because we have these individuals that are coming along. Like I have a 48-year-old autistic CP CVI brother-in-law. His ability to convey when he was sick and he ended up actually having pneumonia, but he couldn't convey what was happening to him. So Sharon, to pull in your adult bedside, like that component, how are we training neurodivergent individuals to grow their professional identity, that they are invited and welcomed here? So obviously not the conversation for today, but for future research ideas.
Absolutely.
But, yes. Okay. I should probably bring us back to the topic at hand. Wow, this was Great. Okay, so to get us back on track, let me pull up the very beautiful questions that were submitted beforehand for us to stay on topic. So, what is professional identity and why is it important?
I will pass that to Sharon and Anita to lead us in that response.
Okay, I'll give a little 2 cents because Dr. Fitzgerald's the expert. So from more of a non-expert in professional identity, but who's somebody who has the lived experience and who has done quite a bit of work, but not the extensive global work. I've just only done local work with this professional identity, but I understand it to be, what is my value? What is my skill set? What is my knowledge? And what behaviors do I have as a professional? And it was important for me to have an associate degree and the bachelor's, and looking back, because at each step, if you will, of my education, I understood more knowledge. I understood more of the values by being maybe a little older and having some of these lived experiences.
Yes.
So it's kind of like, how do we shed that imposter syndrome by embracing this new role? And one of the ways as faculty that I tend to do this, and others as well, is one, by knowing people's names. If you know their name, then they feel like maybe they belong. Another thing is at our university, at least in our School of Nursing, we have a majority of our classes that can be hybrid. But I always choose to I teach primarily first semester, and I choose to have those classes on campus, because I feel if they come to campus and they're actually in a school of nursing, then they're more likely to identify as a student nurse. And if you identify as a student nurse, it's an easier transition, or a speech and pathology student, it's an easier transition from the student role to that professional role. So that is kind of in a little summary how my time spent doing a little bit of research and working with Dr. Fitzgerald is the cutesy, simple way to kind of define it. Dr. Fitzgerald is much more rude, I would say, than I am.
No, you bring up some really important points about, things that contribute, being in an environment, being acknowledged, being called a student nurse as opposed to a nursing student, right? Emphasizing that role. When we talk about professional identity, there really are, you can sort of put it into 3 important elements, right? So the first part is a sense of one's own self. I identify as I am a speech language therapist. That first part of that own personal identity. And the second part is in relationship to others. So I not only myself individually have that identity, but I also belong to a community of, SLP therapists. And it could be a subgroup or it can be the whole group. And the last part is something that Sharon said so well, was about just sort of the values and the norms and the characteristics of the profession, so that you feel like a speech language therapist, or you identify yourself, you think, and then you act, right? So those 3 parts I think are really important. It all goes back to the identification, and this is, at least for nursing right now, kind of a hot topic, because we've been told that we're not a profession.
Same with us.
Yeah. I'm sorry.
Okay.
Yeah.
For the record, for those of you that are not aware, sorry, I'm not even looking at the camera. I'm yelling at my microphone. The current administration has decided, and I say this hot because not only am I an SLP, but 2 of my sisters are nurses. One's a cardiac ICU nurse. One is an adult geriatric GI nurse, but nobody wants her job. That just sounds gross. But we were all deemed non-professional, so that our funding, our grants, our scholarships could get gutted and capped. And you said something about values and norms. And our association this summer put out, as well as I believe CAPSA did a follow-up, they felt compelled to change our accreditation standards to remove the words diversity, equity, and inclusion from the standards to meet current administration guidelines. And as it was told to me behind closed doors, well, actually in a hallway, but not to be repeated by who said it. But if we didn't, it would put essentially a bullseye on the profession. And
a lot of good that did, right? Because you still have the bullseye, right?
Yes.
And if you look at that list, it is all mostly women-dominated fields, right? Teaching, SLP, nursing, and this actually is not a new thing, right? It took a long time for both our professions to be acknowledged. They used to call us the term was a semi-profession, right? Where, there's sort of a characterization of what makes a profession, and it has to do with, again, the comportment
amount of males in it. Sorry.
But it also, but it involves like a compact, right? The community recognizes you as a profession, and as a profession, you provide services to the community. So what's happened is all this work to sort of cast off that definition of being a semi-profession, it all gets thrown away because it's that compact, right? I mean, we do have to remember it's the government, not the people, but that compact of we provide services, professional services, and you acknowledge us gets shattered by this.
Yes. Belinda, you want to say something?
Yes, I just wanted to add a point of clarification so there's not a mistake of misinformation about some of the standards changes. So some of those shifts in the semantics in shifting to terminology, I think that currently says person-centered care, was also to reflect the needs of some of our academic programs in particular states that have really much more restrictive laws, regulations around DEI as we know it at present. That is something that I just think is important for us as a field to be a bit more sensitive to. I know I had to really take a step back as a Californian because it's so unfamiliar to me in this space where we are, but that for quite a few of our colleagues who are practicing teaching in states where the university can't say certain terms, the departments can't say certain terms, the, university systems that they're working within were much more restrictive. It was making it quite challenging for them to maintain their programs and maintain our accreditation standards before the changes. So I do just want to acknowledge that while the semantics might have shifted in response to meeting those needs of those programs, the value of what we do as a discipline, who we value, I don't think that has shifted at all. I think the value of, while we might now have shifted it to person-centered care, the value is in supporting our clients, our students, where they are, who they are, with what is going to best serve their needs. So I just want to clarify that I think that has certainly not changed. The value is still there, and I'm hoping that value remains consistent for the next 100 years of ASHA.
Yeah. There was, we did an episode this summer with Reem Khamis, Faye Murray. They pulled all of the speakers together. And one of the things that they brought up was that graduate programs have to adhere to regional accreditation. So folks, when she's talking about the states, they have to meet like the CASA standards set forth by like Council of Academic Accreditation, and which is aligned within the ASHA framework, but it also has to meet, that university program also has to meet their regional. And so that's the specific. So those in the Southeast predominantly, those regional accreditations, and I'm from South Carolina, we don't live there anymore. And I'm grateful for those stars having moved, but yes. Okay.
It's a challenging topic. I think working in this national role, even in student mentorship, things that I have been privy to over the last 3 years of my role that I wouldn't have known as a California-based practitioner, where we have, really different practices out here apparently than people have nationally. But there were students who at one point they were barred from using books in any of their therapy tasks because of book bans. And so they didn't want them to use any books. So again, I think unless you, when you haven't heard all of those kind of tidbit stories going on, it's, it's challenging to see that bigger picture if you pull out. And so, one of the things that I encourage us to do in our field as changes are happening and shifts are occurring is understanding that the organization as a whole really does have the core value of diversity, equity, inclusion, person-centered care, support. So however the semantics may or may not shift, the value is there, has been there for some time, is really a core tenet of who we are. And, kind of shifting from that into the thought about the article and professional identity, what I thought was super interesting when I started to get familiar with the topic and Anita's work is just that there was such a heap of research literature in other disciplines. There was so much out there about professional identity and development in nursing and in social work and in several other allied fields. Yeah. And when I was working with two undergraduate students who were first generation students, are from minoritized backgrounds. They were working with me on a program that CSULB offers for first generation students to get involved with research with a faculty mentor, and they get paid for that research time, which is great. So their task was to do a literature review and find everything in the SLP field regarding professional identity. And they came back after the first couple of weeks and said, we have really looked everywhere. We can't find anything. And I said, what do you mean? And so then I went out and I couldn't find anything. And so I was just kind of shocked about just the gap in the literature in this topic specific to CSD, to communication sciences and disorders, as opposed to our allied disciplines who had so much literature in this particular area and talked so deeply about how important it was to the recruitment, retention, how we get people into our pipeline. And so I was just really excited to dive into this because there really wasn't there was no existing literature in our field on this topic.
That's why I think this work is so important. It gives, it gives people something to build on, and I think it's important, and that's part of the importance of the interdisciplinary work as well, because there's a lot of some of the real seminal work is in medicine, right, and that it is integrated as an intentional part of the training, which is something
what does that mean? Like, how do they integrate it intentionally?
So, for example, they do in medicine, most programs have not just training like this is what professional identity is, but they support it by the use of things like reflective exercises, by a lot of integrating students into social environments. So if there is some sort of like a committee that's meeting, or even if there's at a conference where there's like a social hour, they make sure that students are a part of that they start to get used to that kind of activity. And that feeds, of course, that belonging, but it also helps the student grow in their professional identity. Yeah. Yes. So they do it on purpose. Like, we just sort of send students out there and hope they learn something from the right kind of professional. But I think there's ways to incorporate it more intentionally.
Yes. Okay. So you pulled a neuron, Gerald Jackson, who was the chair of the conference. He was the SLP co-chair for our national conference last year. Him and Kim Ward, who was the chair, she was the the audiology co-chair. Mm-hmm. They put out, they're beautiful humans. When they were creating the convention planning, they were very systematic in stating that they wanted a student involved in each individual subcommittee.
Yeah.
Systematically open the doors. And they were very firm when they were doing their planning last year that they wanted individuals that had not been on committees before, that individuals with different backgrounds, different experience, systematically growing.
Yeah.
As Belinda, as you were talking earlier, we are a monoculture, right? But opening those doors. But what I loved was that they focused on adding in the students, because so rarely at that national level do students have an opportunity. And it was to be intentional at that level is huge. But yes,
Absolutely.
So okay, now I see what you're saying. But I love, or on your state associations, grow your students within your state associations. Yes,
I just think anytime you can get a student outside of the classroom and into something that is discipline related, discipline specific, it really gives them the opportunity to kind of put theory to practice. It gives them the opportunity to envision themselves in that space. I think it's my kind of entryway. I got introduced to speech language pathology because my mom is a business owner. She owns an insurance company, and one of her clients was a speech language pathologist who had a private practice. And so it was my first job was as a high school student was working at a camp for children with disabilities. And I learned what a speech language pathologist was, and I learned about autism, and it was just the most awesome experience. And so for me, by the time I even got to graduate school, I had spent years working at that camp. And so I already felt like I had gotten the opportunity as a volunteer. I was leading small groups. I was assisting. They were like, you should really go into this. You're really good. I'd gotten all those little side kind of nuggets of encouragement. And so by the time I got into my graduate program, I didn't know that our field was underrepresented because the practice where I worked was so diverse. And so when I got into graduate school and I looked around and said, oh, well, this is not what my experience looked like, but I was already so confident that I belonged there.
You had a professional identity.
I had that as I entered. And so I was in college at an HBCU that didn't have a CSD major. I majored in English and Spanish. But when people would ask, well, what are you going to do after graduation? I said, I'm going to be a speech language pathologist. So I already had that very solidly ingrained into me. I'm very grateful for that mentorship from Dr. Pamela Wiley. She is an ASHA fellow, owns Los Angeles Speech and Language Therapy Center, has been around for decades. But the idea of having a mentor kind of sew into you, show you that you belong in this space, can stick with you for so long, right? So that concept to me is so important of having those experiences in the classroom, but also outside of the classroom. So, and hopefully you can get them in both, right? So, but I think for students, if they are having experiences outside of the classroom, to me, it increases the opportunity for them to have that aha moment, right? It gives them another potential mentor, potential supporter, a potential vision that they can see themselves into. And I think that's super important for them. So sometimes students, particularly at our university, we teach a lot of first generation students for the CSU system broadly. It's considered a university that really shifts students' trajectories in terms of their possibilities, because a lot of our students are first generation students. We have a lot of students who are from minoritized backgrounds. We're a Hispanic serving institution. So there are a number of our students for whom entering college itself is different. It's unlike something that they maybe have a lot of experience with or familial experience with. And so seeing themselves, however they got there, and being able to project a vision of themselves 4, 5, 6 years from that point, knowing that they're going to be on the other side at an ASHA convention as an attendee, I think is really, really important. And having those opportunities to, sure, read something in a textbook, but see it happening in a session, see a pediatric swallowing session and say, I could do that, or see those things, I think is really critical for their development and their retention.
Yeah. And to sort of build on that too, that because what you're saying is sometimes it's not even as formal as mentorship like you had, but it could be someone says, you're really good with kids and you ought to go into something that or you're people always told me, some of the student interviews I've done, like people always told me I was caring and that because of that, I thought I could be a nurse. Right. And these things it's just sort of an expression of the fact that one's professional identity is a subset, is a part of one's personal identity, that you cannot separate the two. That how you develop professionally builds on who you are personally. And so those things are important. And when you get encouraged by saying you're really good with kids, or I like how patient you are with so-and-so, that helps a person start to see themselves as whatever, a speech language therapist or a nurse or a social worker, right?
One of the things I always found interesting was the amount of ACEs, that adverse childhood events, that some of our first gen students came with. And when we're talking about you hit it on the head, Anita, when you can't part and parcel, Waffles agrees, you can't part and parcel professional identity from personal identity. Yeah. But how are we equipping them for the long run? Because if we're looking at both of our callings can be hard on one's social emotional aspects, right? And so I do feel like when we're looking at cultivating that mentorship for professional identity, we also need to make sure that we're giving them the scaffold to take care of, my family calls it their muchness, but like that fundamental aspect, so that they feel secure in who they are to then turn around every single day and go out. We all were there through COVID. We all have the stories if we practiced or if we served those that practice, but I can't fathom not having had the support that I had going through it professionally, servicing those and systematically and being intentional supporting the graduate students that I was working with. I don't know. Those are so many different thoughts jumbled into one, but one of the aspects of the article was that the multilingual students struggled more with this. And I know that at the PWIs that I worked with, a lot of them had more adverse events. So they were at risk for needing a little more counseling and help to make sure their hearts were secure. So thoughts, feedback?
To me, I think, Sharon, did you have something?
I was thinking, like, from some of the first generation students I've worked with, since they do not have that, their parents who might have been, a lot of them, their parents aren't professionals. They have a job, they're employed, but they're not seen as a professional. And so the students who have struggled sometimes and they go home and tell their parents, the parents have made comments like, well, you can just quit. You don't have to continue. And so that's where I find like we need to bring it, is like you are not seeing yourself yet as the student nurse or as the student social worker, etc. So it makes us, those of us who do have a strong professional identity, to help them during these initial phases when they're trying to identify in their profession, as well as, they need to be internally driven to be able to do the work. And so having the confidence to be able, not some things I think we do with faculty, we would not have accepted you into this program if we did not think you were capable and compassionate of doing the work. So instilling in them, if their parents or whoever that is in their home life isn't able to help them with that. Because I have never heard a non-first generation student say, I'm just going to quit then. That's not an option for them because they see that they have success in their home. They know that if they work hard, maybe they need to get a tutor or use the resources, they'll be successful. Or when in other families, they might be saying, well, if it's too hard, that's okay. You don't need to do it. And so that's when I find the biggest struggle is, fortunately, I'm at a university where most of the students are academically quite strong. And so that doesn't seem to be a huge issue. It's more the mental component of it, where I feel like I need to be perfect. I need to be an A student. And then sometimes they sacrifice their own health because they're so driven for their grade and they're not driven more to be a well-balanced individual. And so that's sometimes some of the struggles I see with the first generation students there. But yes, it is an upward battle, and they need to know that they are not alone, that we have the resources, that we have, we're rooting for them. And I just had a student in my office this afternoon, and she was a student the first couple of weeks of class that she wanted to not be enrolled in the program. She was first generation. She was here because of external reasons. You're smart, you're caring, therefore you should do this. And she came to me and she wrote me a beautiful card and a gift. And she said, thank you for, having me stick it out and talking me through what it looks like as far as doing the work and also what my life could look like in a couple of years if I do this. And I don't stay at my, barista job, the potential that I have. So it's fortunate for us all here on this podcast participants because we do have strong professional identity. So that strong professional identity allows us to be confident in our role, allows us to be confident in our expertise, allows us to know that we do have a right to sit at the table. And when I hear that we're not a profession and I make these little silly jokes to myself, okay, that gives me permission to be 10 minutes late because now I'm not a professional. Then I say to myself, no, part of your professional identity is to be the best you can be, regardless of what somebody else is saying about me. And so I try to help the students with that as well. You can do this. You are doing this. Yes, it can be challenging, but that will help you to be more resilient and to be a better, hopefully, a care provider. And then also help you to learn a little bit about yourself along the way and shed some of that imposter syndrome. So you know that you are deserving and that you have a right to be of service and to help other people and to have meaningful work.
Yes.
If I can also add a bit to what Sharon said, which is so wonderful, just thinking about the idea of also reframing and seeing, something untraditional or being a first generation student, viewing it from a strength-based kind of lens instead of more of a deficit approach. I think when some of the things we can discuss with students is seeing those things as assets, right? So when you are a first generation student, you are really adept at figuring things out. You are really strong at seeking out support when you need to have support. You are typically really quite strong at juggling multiple roles, whether that is part-time work and school work and, support for siblings. And, so I think framing some of those experiences as assets, I think, is also really important. One of the things I stress quite a bit is finding ways to support students, whether they're first generation or not. Maybe they're just students who have the necessity of having to work, right? So finding ways on university campuses and in systems to pay them for those experiences that help to build those types of professional identity building experiences. So things like paid internships, paid research experiences, encouraging them to apply to fellowships, grants, telling their story. I think that's super important because a lot of students would maybe really like to engage in research, but don't have an additional 5 to 10 hours a week to do so because they do need to work as a barista to help pay bills or help support their family or support loved ones. And I think that those are real concerns. So I know at California State University, Long Beach, one of the programs I have publicized as much as possible within our department is the Undergraduate Research Opportunity Program, which pays for students to engage in research, the Summer Assistantship Grants, which also pays students to engage in research. So if you can find opportunities for students to have paid employment, that also gets them experiences in their future discipline, I think those are really impactful and meaningful experiences for them to have. And seeing that, professionalism is all over us, right? So it is, I speak to students about myself working at Lady Foot Locker, and I felt just as professional then as I did now as a speech language pathologist, in that I would have, customers walk in and who were monolingual in Spanish, and I was the only Spanish speaking, sales associate, and I would, go up and assist. And I take that same point of pride in being someone who I would hope would help someone else. So I think that there are opportunities for them to build professional skills in whatever discipline that they're in, or whatever job that they're in, and to take those soft skills and transfer them into our field. But I can't underscore the importance of them having some type of experience directly in the field. And I think letting them know about those experiences, encouraging them to apply for those experiences, encouraging them to apply for scholarships and grants. And sometimes they're not things that are, big pots of money, but just being the recipient of something can sow into somebody that, oh, wow, I must really belong in this or be worthy of something. And so encouraging those types of opportunities for students as well, whether they are, if their parents are doctors or welders or, house cleaners, I think they bring that support and love to want their child to succeed. So trying to help the students see that, their efforts kind of get them to that next step.
I love the idea, and have had students that have come with the experience of working as a substitute teacher or a rehab tech, because the amount of interprofessional experience, exposure, education, and practice you get from working as a rehab tech at an outpatient clinic. And you don't have to have a terminal degree to be a rehab tech, but you get to see what the OT and the PT and the SLP are doing. If you're a substitute teacher, you could work within the SPED space as well as the general education space. And those are amazing. But one of the things that I found very interesting, and that Dr. Burns and Dr. Francis Burns and Dr. Michelle Norman, when I was at Francis Marion University, they spoke to me about professional identity for hair, nails, and tattoos within the framework of South Carolina. And historically in South Carolina, you presented a certain way. You didn't have tattoos. You didn't have facial piercings. Your nails were short. There was no color on them. I mean, I know I'm sitting here wearing my pearls, but everybody wore pearls and you dressed a certain way, and this was what was copacetic. But no. And so that's something that I love seeing the shift within the last 10 years at ASHA Convention itself is you can be professional in your jeans and glitter sneakers, because that's my MO, but you can wear your hair how you want. You can have colorful long nails. You can have the piercings. You can have the tattoos. But that aspect of professionalism, which can carry so much weight and so much bias in it.
Well, what it does is say there is one way to be, an SLP, or there's one way to be a nurse, which is just a subtle and maybe not even intentional, but a way to exclude non-traditional members of a profession. So I agree with you. I think that shift is really valuable. It kind of fits into, I always say to students, bring your whole self to nursing. Like you have a lifetime of experience that you're bringing. Like you're not a blank slate. So you have experience, reading a book to someone, or you have experience in those soft skills, and don't leave those at the door, right? And in that same way, don't leave your personality at the door, because when someone comes for care, no matter what the environment, if they can see themselves in that care provider, then they have a better sense of, okay, I can do this, or they care enough about me that I'm really going to work hard on, the exercises they give me when I go home and things like that. So that I agree. I think that's a really valuable shift.
Absolutely. And I think tying that back to the article as well about the differences between like monolingual and multilingual students and their perception of professional identity, I think highlighting for students, I do this often, where I say for students who are applying to graduate school, on your resume right after education, you need to have a section that says languages, and you need to note that you are, multilingual in, whatever languages you speak, because that needs to be seen as an asset, right? And so, I speak quite explicitly. I've done it with National NISLA on our office hours events that will talk about resumes. I've done it when I talk to prospective graduate students for CSULB. And I say, always put whatever other languages you speak right under education, make it a separate header. And sometimes students will put it all the way at the bottom of a resume in really, really small print, or not mention it at all. And I always say, in a profession where 90% are monolingual in English, then being multilingual, that's a really significant asset, right? And so while a program, again, because of legal restrictions or because of administration shifts, things are not quite as different in California, because we have had policies in place for some time by law that restricted us from doing admissions based on affirmative action. But thinking about for students to disclose that information on their own, because I can't unknow it once I know that about you, right? So I want to know in an application, that you are also from a diverse background and you speak different languages, because what a different thing that is in a field where the majority of our members do not, right? And so it certainly presents as something for our multilingual students to think about that as, one of their superpowers, right? So I think that is something that's really important for students to be able to think about, where yes, they're thinking about they should be in, try to get engaged in research opportunities or volunteer opportunities or shadowing and observing, but also saying I'm fluent in 2 other languages. That's really quite impactful and would be something that would be a very valuable skill set for their future clientele that they might treat.
Yeah.
I've had the joy of supervising a student who came from the HMONG, Hmong, yes, as well as several students from India. And one of them had an unpleasant microaggressive experience, a microaggression experience in a clinical practicum. And I was working with the external clinical supervisor on how they needed to shift thought process, but also for the student. And it boiled down to when she was doing a bedside eval with an adult, she didn't make eye contact. She was looking down. This gentleman was a senior, and it was a similar narrative for working in a rehab facility for the other student. And the students shared, and I'm paraphrasing because it was 2 experiences, but it boiled down to, but that's me showing respect, because that's part of their culture. And we ended up flipping the narrative into this beautiful aspect of your culture is allowing you to see the world through a lens through which your clinical supervisor doesn't see the world through. So how can you share what you did see and what you did observe, the reading of the room that might have gotten missed by the one that was narrating and leading and like the clinical supervisor, but seeing their culture as a whole and how they engage with other humans. And that for those that may come from cultures where you are more quiet or you are more reserved, there's power in quiet. And SLPs don't shut up. So like, to be fair, we're a little loud, but like encouraging those students to see that. I don't know. It was beautiful to watch those. I called them my speech babies, but to see our speech babies grow, and now they're off doing amazing good things. But
Yeah.
okay, we could talk all night. This is great, but I know y'all are West Coast, so y'all have students that you have to go teach or families to go home to, and I have gentlemen that are waiting on pizza movie night. It's Friday night. We're recording on a Friday night, y'all. But on that note, what final thoughts do you each have? And then if somebody has a little love money, who could they donate to? But please share your takeaways, your thoughts that you want people to leave with.
So I will say my final thought is in really kind of speaking directly to students, in that if you are in this field, this field is so broad that there is a space somewhere in it for you professionally. There are so many different facets and specialties and settings that I've never felt when I've engaged with the student, no matter what background or kind of what their story was, that I've never met a student that, they can't be an SLP. I've just never thought that, because there's such a broad definition of what an SLP is, right? And so many potential spaces for us to live out our professional kind of destiny. So there's so many different options for you. And so if you don't feel that you belong in this field, if you don't feel that there is a space for you, my challenge is just that you haven't found the right space for you yet, but it's there. And so I think that that's something that's important. And then for those of us who are on the professional side, I really encourage us to, talk to a student. It doesn't have to be an in-depth mentorship experience, but even a micro experience with the student. Take someone on for a semester, or go, contact your local university and offer to speak to their NISLA club about your pathway. I think those types of experiences, hearing from you, hearing your professional journey, can be very, very impactful for them. And just being honest and real about how you got to where you are, I think is super impactful. And if there is love money to be shared this holiday season and beyond, I would direct people to National NISLA to support. They have a space where people can donate membership scholarships to students, so students can become members of National NISLA who might not otherwise be able to afford that. And it's an opportunity where National NISLA is 100% dedicated to helping students go from student to professional, helping them find their people, find their space, find their voice in this field as they try to get to that next step in their professional career. So,
yes,
that's wonderful. Yeah. There was one thing I wanted to add, because we've been talking a lot about what are ways within education, within our role as mentors, to support the student to develop professional identity, but it is bidirectional, because the sooner a student, and this is why I'm so interested, the sooner a student takes on that mantle of an SLP professional or a nurse, the sooner they take on that identity, the more engaged they get in their learning. So developing professional identity helps them to learn more, because they say, oh, this is me and this is something I'm going to do. And they go from, being an observer to being a participant. So it is important in both their role as a student and in their development. And part of the article that we did was talking about levels of support that students felt for the various aspects of their professional identity, and then things that we as educators can do to help students to develop that. Because again, then it comes back and it helps the student develop as a student as well.
Yes. Yes.
We could, I'll wrap things up for us. So professional identity is not static. It grows as we take upon new roles in our profession, as we gain new experiences, as we're adapting to the profession that is changing. If you have any doubt, I tend to tell the students, keep showing up. Every time you show up, you're going to learn a little bit more. You're going to feel a little bit more like that healthcare professional. I also encourage them to dream big. If your dreams aren't scaring you, you're not dreaming big enough. So inspiring them, motivating them. Also, us being confident in our roles, because they see us as they want to sometimes be like us or emulate us. So if we can be confident and we share the stories, I share many stories of the silly things that I've done along the way. And then, you learn from them. You make a different mistake. And all these mistakes are stepping stones to greatness. Allowing yourself and also telling yourself as the student that the program is designed to keep me and the patient safe. And I will get more responsibilities, more skills as my scope of practice expands. And they're giving me what I can handle at this phase. So having faith in how the program is being unfolded could be helpful if you're struggling. And then also, like we've said, use the resources. So many students feel like they need to go at it alone, and they're carrying all this burden. As soon as you share with one person, sometimes you feel a little bit lighter just because you've shared, and then that person can give you some confidence, can give you a resource, or say, hey, go speak to this person. So keep showing up. I think that's very important, and to keep growing and having that growth mindset, and then giving yourself some grace, because we're all not perfect or ideal on every day of the week.
Yes. You mentioned before we got started, that your love money was the beach pantry. Am I saying that correct?
I think I want to support Belinda's recommendation for the student. No, I think that's really valuable, especially given the conversation we're just having about helping support students to develop their professional identity and their sense of belonging in the profession. So I really want to double down on Belinda's recommendation.
Yes.
And this is why we're a great faculty collaborative team here. So support at CSCLB is unmatched. So every university is great, but go beach,
That's right.
I'm going to add one more. It's the holiday season. And because there's little ears upstairs and down the hall. Once upon a time when I was a graduate student, I was also a domestic abuse survivor. And so holiday seasons can be very hard. And I would strongly encourage, if you have a little extra love money, to donate National NSHLA, but also find your local domestic abuse shelter and check in on your graduate students. If you're a clinical supervisor, if you're faculty, you get to know the future generation on a whole nother level. And it was 2 faculty that picked up on what was going on in my world that allowed me to be safe and to literally be here today. So it is because of those women, Dr. Power Defer and Dr. Carol Dudding, that I made it. So huzzah, because, 1 in 4 of us will endure it. And mine happened in grad school.
Yeah.
So let that be part of your story that you tell to make us stronger collectively. So there's that. But I always cry in these, and there's no tissue nearby. And I just put mascara on for tonight for 1 hour, and then Sharon, Osmosis Jones through the universe.
Yes.
But ladies, this was absolutely exhilarating. Thank you, thank you, thank you for the work that you're doing. Everybody, please, if you don't have access to it today, the SIGS paywall disappears, I think, as of January 1st. So you'll be able to access, yes. So it is, for the record, again, Professional Identity and Speech Language Pathology students. It was Volume 9, Issue 6 from December 2024. And it was just, it's a good read. So thank you. Please keep publishing. Please keep doing the work and doing the hard things. Y'all are appreciated. Thank you.
Thank you so much.
Thanks
Appreciate
for
you having
having
us. Thank you.
Yes.